Welcome back to Dr. Ryan, your trusted place for simple, science-based wellness tools that you can put into action right away. Today, we're talking about something that affects millions of people, sciatica. If you've ever felt that sharp, radiating electric pain shooting from your lower back and your buttock, your hamstring, or all the way down to your calf or foot, then you know how debilitating it can be. Sciatica isn't just a little back pain. It's the kind of pain that takes over your day, ruins your sleep, limits your movement, and steals your ability to walk, sit, or even stand without discomfort. The surprising truth is that most sciatica pain comes from something you wouldn't expect. The loss of the natural curve in your lower spine. Your lower back is supposed to have a gentle inward curve. That curve is what keeps your discs aligned, distributes weight properly, and protects your nerves from compression. But modern life destroys that curve. Hours of sitting, slouching, driving, and leaning forward at a computer gradually flatten the spine. When the curve disappears, pressure builds on the discs, and when a disc bulges backward, it irritates or compresses the sciatic nerve. This compression leads to the classic sciatica symptoms: burning, stabbing, or aching pain traveling down one leg. Interestingly, sciatica usually affects only one side of the body because nerve compression tends to happen unevenly. And if you've ever noticed that the pain deepens when you sit or rises when you stand after sitting a long time, it's because the disc pressure increases dramatically when the spine is flexed. To truly relieve sciatica, you need to do more than just stretch. You must restore the natural curve in your lower back, release the nerve tension, and rebalance the body's pressure patterns. Today I'm walking you through 3 simple steps that help accomplish this. These steps don't require medication, special equipment, or expensive treatment. They work by allowing your body to return to the structural position it wants to be in, one where the sciatic nerve is no longer irritated. Before I explain these steps, I want you to do something important. Quickly rate your current pain on a scale from 0 to 10. 0 means no pain. 10 means extremely severe pain. Remember that number. At the end of these steps, you'll check again and notice what's changed. The first step is restoring the lower back curve. This is foundational. When the lower spine regains its natural shape, the disc pressure reduces almost instantly. You can use a foam roller, or if you don't have one, just roll up a towel. The key is positioning. You're not placing it at the lowest area of your spine. You're placing it a little higher, around the first lumbar vertebra. This placement lifts the spine in just the right way to encourage the curve to return. You lie on your back, bend your knees for support, and allow the roller or towel to gently push your lower spine upward. As the spine lifts, the discs open, and the nerve gains space. Just a few minutes in this position helps settle inflammation and reduce nerve irritation. This single adjustment often brings immediate relief. People who have been sitting all day usually feel the pressure ease almost instantly when that natural curve is reintroduced. Doing this in the morning and again at night can help retrain your spine and decompress the nerve throughout the day. Once the curve begins to return, the next step may seem unusual, but it's incredibly effective. You stimulate the sciatic nerve on the opposite side of your body. Most people instinctively massage or stretch the painful leg, but the irritated nerve doesn't like to be pushed on. It's already inflamed and sensitized. Working directly on the painful side can make things worse. Instead, the secret lies in stimulating the mirror image nerve pathway on the opposite side. Your nervous system operates in circuits. When tension builds on one side, releasing the nerve on the other side causes the affected side to calm down. Pressure dissipates across the circuit, and the painful nerve no longer feels overloaded. To do this, you locate the sciatic nerve pathway in the opposite buttock. You apply gentle but firm pressure starting near the sacrum, tracing the nerve downward through the buttock, into the hamstring, and sometimes toward the calf. This should be tender, not unbearable, but definitely sensitive. The tenderness is a sign that the nerve is tight and needs release. We slowly work along the nerve pathway, spending a few seconds on each spot, allowing the tension to soften. This is most effective when someone else helps you, but you can also use a tennis ball if you're on your own. Placing the ball under the opposite buttock and rolling gently will help you find tight areas and release them. You continue tracing the pathway as far as your pain travels. If your sciatica reaches your foot, you treat the opposite calf and foot pathway as well. What makes this step powerful is that you're calming the nerve network, rather than aggravating the already inflamed nerve. Many people are shocked by how much relief they can feel in just a few minutes. The third step brings everything together, stretching the quadricep on the same side where the pain exists. When the quad becomes tight, it pulls the pelvis forward, increasing pressure on the lumbar discs. This pelvic tilt worsens the compression on the sciatic nerve. By stretching the quad, you realign the pelvis, relieve strain on the spine, and further reduce nerve irritation. You grab your foot, gently pull the heel toward your glutes. Hold the stretch for a few seconds, then relax. Repeating this several times helps restore balance through the pelvis and spine. As you combine these 3 steps, reintroducing the spine's curve, stimulating the opposite nerve pathway, and stretching the quad on the painful side, you create a powerful reset for the sciatic nerve. The nerve stops firing so aggressively. The discs decompress, the muscle tension around the pelvis drops, the body relaxes instead of guarding the pain. At this point, I want you to pause again and re-rate your pain level. Most people experience noticeable improvement after just 1 round of these steps. Some feel immediate changes, less burning, less shooting pain, less tension. Others see gradual improvement over a few sessions. The key is consistency. Your spine and nerves respond to repetition. When you give your body the right structure and signals, it will begin to correct itself. For people who sit for long hours, incorporating these steps into your morning and nighttime routine can help prevent flare-ups and support long-term spine health. And once the sciatic nerve settles, your mobility, posture, and strength all improve naturally. Thank you for joining me today on Dr. Ryan. If you found these techniques helpful and want more simple, science-backed solutions to restore your health, reduce pain, and improve mobility, make sure to subscribe and enable notifications so you never miss a new video. Your body is incredibly intelligent. When you give it the right tools, it knows how to heal.